Good evening. This is Arthur Gillespie, Rolfer at Balance Orlando, and welcome to the Rolfing 10 series here with our client Debo. And today we'll be working on Debo's midsection, groin, rectus abdominis, and the balancing muscles of the quadratus lumborum and the buttocks, specifically the gluteus medius and gluteus maximus. Before we begin, today is the midpoint of our 10 series. We're at Rolf session 5, so how appropriate that we'll be working in the middle part of Debo's body. So from last session, we started our core series where we worked with Debo's inner heels, inner leg muscles on both the lower and upper legs into close to the pubic symphysis. Now we're going to take it from the pubic symphysis all the way to where the psoas major attaches in the anterior thoracic vertebrae. So we're going to begin, and I'm going to have Debo walk a couple times to the door and back. And I'm really looking at how Debo can really push off with her toes. That shows me a function of the gluteus maximus, how we can push off, but also how much we're using the balancing muscle, which is the psoas major. And so again, I like the pendulum effect of the spine and the sacrum. This is very good. This allows Debo to have a nice abduction in her hips. This time, we're going to face the camera, and I'm going to have you place your weight on one foot, and I just like you to put your hands on your hips and come up a couple times. And I want you right here, and you can be a little bit closer to the camera.
You want to watch this?
Yeah, and I want you to your feet to be hip width apart.
Okay.
And I'm just looking at how easy it is for you to contract your psoas and come back. But I'm also looking at balance as well. Good. And another time. Okay, and now the right side. Mm-hmm. One more time on the left and one more time on the right. Good. And okay. And which one felt easier for you to contract?
It felt easier to lift this one.
The right leg.
Yeah, and I felt more stable balancing on this one.
On the left foot.
Yeah, so this one I felt wobbly, but I don't know if I was wobbly because of the balance or because it felt like it was harder to lift it.
Okay, let's try that again. Balancing on the right foot and twice lifting the left knee. Mm-hmm. You can place your hands on your hips. And again, well, you're getting really good contraction. Let's try the lift balance on the left foot. Good. Okay. I like what I see. So I have to make a decision as to what side I want to work with first. So I'm going to have you just show your umbilicus, and I'm going to make a decision right now, and your hands are down. And since the umbilicus is slightly to the right of the stitching of your pants, that means there's going to be, of your shorts, there's going to be a little bit less area for all the organs and muscles on the right side. So I'd like to work the left side first. I have palpated Debo's psoas muscles in the past, and the right is slightly tighter. So I'm going to work on your left side first. And so what we're going to do is you're going to lay on the table with your head up, and I'd like you to place your head right here.
Okay.
We finished our walk and putting our knees into our chest to see how easy it is for our psoas major muscle to contract. And now Debo is on the massage table, and I'm going to palpate her ASIS and see if there's any more tightness on one side or the other. So my hypothesis is, since the umbilicus or the belly button is shifted a little bit more to the right, there's going to be a little bit more tightness on the right side. And I apologize for being pokey.
No, it's okay.
What I'm also doing is just gently pushing the iliacus on the left side to the right and the right to the left. And Deborah, which side feels easier for me to push you to the right or to the left?
When you're pushing that way, it feels like there's more movement
Okay,
than when you're pushing that.
let's try from the other side.
It still feels like there's more movement when you're going that way. To me.
Okay. And I would agree. So let's work on the left side, the side that doesn't need as much attention compared to the right side. And what I'm going to do now is
Make me laugh. That's what you're
I'm going to make you laugh. That is correct. I'll try not to be pokey. So just to the medial to the ASIS are the iliacus muscles, pectineus, and also the psoas major. And I'm just going to just gently place my ulna, not my elbow, but just my ulna right there and greet the psoas major of Debo and say hello before we begin. So I'm specifically working from the ASIS all the way down to the attachment of the psoas major into the femur. And I'm just gently finding out if there's any tightness near the pubic bone, more towards the middle, more towards the bone of the ASIS. Okay, so now I'm going to have Debo to place both of her feet on the table. I'm going to put my hands, fingertips, and kind of go underneath the iliacus. And it's easy to go inside the iliacus. Let's do some movement so we get laughter. So you're going to drag this left foot all the way. Good. And we're going to drag it in a sagittal plane, meaning it's not going to cross that dividing line that between left and right. Good. And Debo, if you find any tenseness or soreness or pain, you let me know. Good. A couple more times. Mm-hmm. And two more times. And that's a great speed. And I'm glad you're keeping your foot straight forward. Good. And come on back. And I'd like you to extend both legs again. Now I'm going to come back and palpate and see how if it's a little bit softer to the touch. And the good thing about the upper groin area of Debo is that it's very easy to access. There's very little tightness. What is your experience, Debo?
It feels pretty open.
It feels pretty open. Okay, thank you.
And that one's not making me laugh. And that one made me laugh before.
Okay, so we're going to do this again, but this time I'm going to place my hand underneath the buttocks of Debo, and I'm going to find that point where it's the balancing of the iliacus. So Debo is going to place both of her feet on the table, and you're going to extend your left heel again. So again, I'm inside the iliacus, and I'm also on the balancing muscle of the gluteus maximus. How is the pressure, especially on the buttocks?
It's fine, but I definitely feel it more than I did on the upper area.
Okay, 2 more times.
Definitely more tension there.
More tension
Yeah.
in the back, in the gluteus
Yes.
maximus. Okay, 1 more time. Thank you. And relax this right leg. I'm going to finally come back. And now I'm just really just sinking into the lower belly and the groin of Debo. Okay. Now I've worked on the bottom half. Now I'm going to work superficially on the rectus abdominis of Debo. And I'm going to have Debo to place both of her feet on the table again. Good. So knowing that the umbilicus is slightly to the right, I'm expecting a little bit more tightness on just to the right, on the right side of Debo's ASIS, but also the upper left rib area. This is my hypothesis. So let's begin just gently, lightly taking the superficial layer of the rectus abdominis to the midline. Any soreness or tightness here, Debo?
No.
Okay.
Feels very soft and easy.
Soft and easy, thank you. Debo recently has not complained of any lower back pain, but if she did, I would have her in this position because when the feet are on the table, it lengthens the spine, reducing the curvature in the lower back. Excellent. Now I'm going to have you extend your left heel on my cue, and I'm going to work on your psoas major from the ASIS all the way to the attachments of the thoracic vertebrae on the front of your spine. So I'm going to palpate that bone, and I'm going to have you to gently extend and drag the heel. Good. And again. And stop here. For those who might be wondering how I'm palpating the psoas major, I'm going to have Debo to gently lift her head. Good. Come on back down. And last time. And from here, I can start to feel the psoas major. It gets a little bit harder to feel as I go up towards the thoracic vertebrae. So I'm going to have you to extend your left heel again. Good. And I'm slowly going up into the thoracic vertebrae. And again. And as expected, I'm finding a little bit harder time to sink my fingers into the superficial layer of the rectus abdominis, especially as we are getting close to the ribs, the anterior ribs of Debo. 2 more times, please. And last time. Good. You can place your foot back on the table. And now my hand is going to be on the quadratus lumborum as we do some gentle work again on the psoas major. So I'm going to find the that bony protrusion, the ASIS. And I'm going to have you extend your left heel. Good, and come on back. 2 more times. Excellent. And relax. Okay, so now I'm going to have you to extend your left leg again, and both legs actually, if you want to. Finally checking in with the psoas to see if there's any more softness and ease into the groin area. That feels very good, Debo. Okay, so now we're going to slowly come off the table and we're going to go for a walk. And now Debo is off the table and we're going to take a walk to the door several times. And Debo is conscious enough to place her foot forward where the outer and inner lateral and medial muscles are being used while walking. And again, thank you. Now we're going to have face the camera here, and we worked on the left side. So we're going to balance with the right foot, and we're going to take our knee up. And you can place your hands on your hips. Good. Let's take a wider stance, if you don't mind. Okay. And let's do that 2 more times. Okay, now let's do the right side. Any difference?
This side's harder.
It's okay. So before, 10 minutes ago was easier.
Yeah.
Now it's harder.
Yeah.
Okay, so we're going to rectify that and we're going to work on the right side now.
Okay.
So Debo will come back on the table and with her back on the table so we can work on the right side. Debo is now back on the table after walking to the door and balancing on one foot while raising her knee up into her chest to test the contraction of the psoas major. So now we are on the table and we're going to work the right side now. And as I stated before in the beginning, I saw that the umbilicus or the belly button was slightly shifted to the right. So my hypothesis is that there's going to be a little bit more tightness on the right side. And reviewing my notes from the previous 4 sessions, that is the case. So let's begin on the right side, identifying the ASIS. Some people ask me, Arthur, are you putting your elbow into Debo? And I'm placing my ulna, I call it the dull butter knife, into the rectus abdominis and the upper groin. And right now I feel a little bit of tension. I feel a little bit more resistance compared to the left side.
Yeah, I feel it too.
Debo feels it as well. So that means we'll just take our time, slowly sinking in. And as I head towards Debo's feet, I'm getting even more tightness in the groin. The interesting thing is I'm feeling a pulse, and that's coming from the femoral artery. So a note to aspiring Rolfers and structural integrationists, it's cool to feel it, but don't press too hard and for not that long.
That area is much tighter, isn't it?
You're saying it's much tighter on this right side.
Yeah. Yeah, it definitely feels it.
And also what I'm feeling is just with my ulna, I see it's a lot easier if I took my ulna to your right side.
Right.
But if I try to take the groin back to the middle, there is a more of a resistance.
Yeah, I can feel that.
So now I'm going to take my left hand and place it on the balancing side of where my ulna is, and you're probably experiencing a tightness in your buttocks.
Yeah.
And right now I'm on the upper gluteus maximus of the right buttocks of Debo. And I really appreciate the deep breathing of Debo. Almost done. Another 20 to 30 seconds. Five, four, three, two, one. Debo will place her feet back on the table. And I'm going to put my fingertips right over the edge of the iliacus. And the good thing is I can do that. And I apologize for being pokey, Debo. You're going to slowly extend your right heel and drag it all the way to the edge of the table.
1 sec.
Sure. Good. And I really appreciate the effort you're doing to slow the pace down, but also taking the foot forward. Good. And we're going to do this for about another 30 seconds to a minute.
It's already less ticklish.
Okay, because I'm being very pokey now.
Yep. I said less ticklish, not completely not ticklish.
Not devoid of ticklishness. Right. Okay.
Still do the...
Yes, another 20 seconds. Four more times. Good. Three more times. Thank you for the deep breathing. Good. Two more times. And just one more time. Excellent. Rest here for a couple seconds, and then after you get your breath, we're going to place the right foot back on the table. Okay. Good. And now we're going to extend both feet down, if you don't mind. And now I'm going to retest that area in the groin, and already it's easier for me to sink into just medial to the ASIS. What sensation are you feeling, Double? Are you also experiencing that?
It feels easier than when you first did it on this side.
Yes.
But it still feels tighter than the left side. Especially there.
Okay.
But it definitely feels a lot looser than when you first did that.
Good to know. Thank you. Okay, so we finished the bottom part of the psoas major, and now we're going to start at that line where the ASIS is until it attaches to the thoracic vertebrae. Again, we're going to work the rectus abdominis and work on the superficial layer before we do any deep work. We're now working the upper half of Double's psoas major. And so what I'm going to do is to gently lift the superficial layer of the rectus abdominis before we go and do some deep work in a couple of minutes. So let us begin. And already I'm feeling more of a resistance, especially right by the ASIS. And I believe it's going to get progressively better as I go up towards the thoracic vertebrae. It's the complete opposite of the left side, where there was the most tightness here and the least tightness here.
Yeah, I can feel it too.
It's the polar opposite. Just a couple more times. And one last time. Okay, so double. Now we'll place both of her feet on the table. So here we will begin. I'm going to start a little bit medial by an inch to an inch and a half from the ASIS. And I'm going to have Double to gently raise her head and come on back down. And last time. Good. Okay. So I want you to
So
very.
does raising my head activate the muscle so you can find it better, or what? I'm curious.
That's a great question. It helps me to define your rectus abdominis because it's the psoas major is very close to the border.
Oh, okay.
And then my hands are about 3/4 of an inch to about an inch medial to your ASIS. And then by you raising your head and coming back down, I can also palpate
Okay.
the psoas major. So
Okay.
that's a
Thank
great
you.
question. And I'm going to have you to gently extend and drag the right heel. Good. And come on back. And again. Good. And come on back. And again. And now we're going to slowly go up. Come on back up. So it gets a little bit harder to palpate the psoas major as we head towards Debo's ribs. But I know where the rectus abdominis is, and that helps me as a focal point to track the psoas major. Mm-hmm. 3 more times. Good. I really appreciate the fact that you're keeping the foot straight and the leg straight as you extend. Good. And one more time. Excellent. You can relax this leg as well. We're going to come back to that upper groin and see how easy it is to sink in. Good. I'd like to work, since I know there's the most tightness in the rectus abdominis in the upper left quadrant and the lower right quadrant. I'd like to work here a little bit more for about 1 minute.
Yeah, it still felt better than before, but it still feels tight.
It still feels tight. Okay, thank you for sharing that. We're now going to place our feet back on the table and we're going to drag just the right foot all the way down. Good. And come on back. And again. And if that's too much pressure in the groin, you let me know. And again. Mm-hmm. And again. A couple more times. Good. And 2 more times. Actually, I'd like to do something different. You're going to come back up. Now I want you to extend your foot out wide and extend. Good. And come on back 2 more times. Mm-hmm. And last time. Thank you. And now you can relax both feet. So we have finished the right side, the upper quadrant of the psoas major, and I'm going to ask Debo to slowly come off the table and let's take a walk. Debo now has gotten off the table and she's going to walk twice to the door and back. So I like the fact that Debo's walking in a sagittal plane, that plane that bisects left side of the body and right side of the body. I appreciate the fact that the pendulum of the spine is moving even easier. And so now we're going to walk towards the camera. And since we worked the right side, I want you to balance on the left foot and place your hands on your hips and feet are hip width apart. Let's come back, feet a little bit wider. There you go. And now take.
I never know what hip width is.
That is hip width. So that's
Okay.
good to know. And you're going to gently, good, come back up. And so instead of coming more out, I'd like you to come straight forward.
Sorry.
That's all right.
All right, I'll get this right eventually.
Okay. Good. And one more time. Good. And I want you to compare that now to the left side. And two more times. So you can see it's easier for Debo to take her left knee into her stomach, contracting her psoas major. You're going to go two more times to balance on the left foot and take.
Or balance on the left foot.
And raise the right knee into the chest. Good.
Yeah. The left knee gets up higher, doesn't it?
Yes.
Yeah.
With less effort.
Yeah.
So I'm going to have you to come back down to the table, and now we're going to do work on both sides of the body, and I'm going to start at the pubic bone. Remember, wherever there are bones, there is fascia, and sometimes fascia can get very dry and sticky, so we're going to work that spot right now. And I found that to be very sticky and tight on the right side of your pubic bone. So whenever you're ready, let's come back onto the table. Debo's back on the table. We have completed the left side first, the side that didn't need as much attention as the right side. Now we're going to do both sides at the same time. I'm going to start at the pubic bone. And when I was working Debo's right side and gently pressing in with my ulna, I felt a stickiness, a tightness, even a soreness on the right side of Debo's pubic bone. So I'm going to have Debo place her feet back on the table. And I'm just going to very gently, not being so pokey, find the pubic bone. And I'm going to have you to extend your legs. It's a little bit easier to find it. There we go. And gently come back up. Good. And I'm just going to just hold it here just for about 20, 30 seconds. My intention is to just gently melt it away, just slowly sinking in. How are we doing, Debo? It's a very unusual and sensitive part of the body, so communication is key. Now, I'm going to have Debo to slowly extend both of her feet at the same time. Good. And slowly come back. Excellent. And we're going to do this a couple more times. Here we go. Good. And slowly come back up. Good. And two more times. Coming back up. One more time. Excellent. And stay right there. Just doing a test to see it's easy for me right on the pubic bone ridge to take my fingers from right to left, which is devil's right side. But when I try to take my fingers left to right, which would be devil's right side, this is where I'm experiencing tightness. So just on the right side only, I want you to drag your right heel into the table and gently come down. We're going to do this 2 more times. And last time. Okay, let's just take a couple of deep breaths here. And then Deba will slowly place her feet back on the table. And I'm going to have you extend both of the heels and extend them so that they're dragging. And I'm right on the edge of the rectus abdominis. Good. And slowly come up. And I'm just slowly inching myself towards the attachment of the psoas major right into the thoracic vertebrae. When I'm doing this, I feel more resistance on the left, or shall I say it's easier to sink my fingers into the rectus abdominis on the left side. A couple more times. And again. Okay, 2 more times, please. One. And last time. Good. I want you to relax right here. I'm going to go back to our original test.
When you were doing both sides at the same time, I could really feel the difference.
And what difference was that?
That the left side, it felt, I don't know, like more pliable, and the right side, it felt more resistance. I could like really tell the difference when you were doing both at the same time, because I could compare them, immediately to each other, and that was really noticeable.
So still feeling a little bit softer compared to about 50 minutes ago into the right side. Even in the pubic bone, it feels a little bit easier to sink in. So these are great comments by Debo. What I recommend for those people where it's still tighter on one side. So for Debo, she's tighter on the right side. I'm going to have Debo, to take your entire body to the edge of the table. And I'm going to adjust the headpiece for you. And I want you to extend. Good. So what Debo's going to do is to just gently take this leg and drop it down. And when she drops it down, she's getting a nice stretch in the groin. Now, for some reason, some people might say, I don't feel any stretch. So what I like to encourage those people to do is to take their hand and their arm and take it, if they can, all the way back. So you're getting a nice length in the chest, in the rectus abdominis, and in the groin. If you still don't feel any stretch, then what Debo is going to do with eyes open is she's going to gently kind of curve over, there you go, to her left side.
If they don't feel a stretch by now, they're not human.
And if they still don't feel the stretch, what you can do is very gently take your palm and gently press down into the lower quadricep muscle. And you can hold it here 30 seconds to 2 minutes, whatever feels good to you. And if you still can't feel it, or you need even more of a stretch, Then you can take your left ulna, find that ASIS, and just very gently press right into the groin, very gently. And how is the pressure here with my ulna?
This feels amazing. This is like the stretch I always needed.
So you see, this is one of the few exercises where there's no movement. For most of the session, Deborah's done a lot of movement and dragging her heels, contracting her hamstrings, contracting her psoas major, and lengthening the psoas major. And we're going to hang out here just another 30 seconds or so. And so while she's slowly breathing into my ulna, I'm just gently going to go a little bit more medial to where the pubic bone was. And another 10 seconds. Good. I'm going to slowly place Devil's right leg back on the table, ask Devil to come back to the middle of the table, and I'm going to do another test to see if that helped at all. Still easier, but where there's the pubic bone, okay, the bone is hard, so I'm expecting to feel something hard. And that's a good sign that Devil has a pubic bone. And I'm making a joke. But now I'm going to go onto the other side and see what that feels like on her left side. Can you tell the audience the difference between the left side of your pubic bone and the right side?
Yeah, it almost feels like you're not even doing the same move because it feels so, how to say it, it just feels so open on this side.
Yes.
So I don't feel any of that tension. But on this side, on the right side, I felt so much more because it's so much tighter that it's really good.
Okay.
I don't want to say it hurts because it doesn't hurt, but it's more tender.
Yes.
Towards the bone on this side, and I mean it almost feels like you're actually like pressing like right on it or something, and whereas on this side you're doing the same move and it doesn't feel like that at all on the left side because that tension isn't there, that soreness isn't there.
Okay. Thank you for that observation. Now, before we conclude, we are going to segue into Rolf session 6. Rolf session 6 will be one of the few times where we take Debo and place her on her stomach to work the posterior chain of her lower body and lower back. So we're going to start from the bottom of the foot, the Achilles, the calf muscle, hamstrings, gluteal muscles to the lower back. What I'm going to do right now is come on over to her left side, and I'm going to gently take her knee into her chest. And what I'm doing right now is some preparatory work where I'm going to take my knuckles and I'm just going to gently work on the hamstring attachments as they attach to the sits bone. And I'm starting on the medial side closest to the center of the body. And I'm gently fanning out to the outside. And then back to the middle. This is also a good test to determine how easy it is to see how easy it is to take the knee into the chest, which means how easy it is to contract the psoas major muscle. So thank you, Debo. And now we're going to work on the right side. We're going to take Debo's right leg and again we're going to start in a downward motion with the knuckles right in the middle or closest towards the coccyx and sacrum and fan out. Debo, do you find, or are you finding any more tightness on one side versus the other? And when you're pointing, may I say that that's more tightness on the right
Yes.
hamstring attachments into the sits bones. So a nice exercise for Debo when she gets back home or to the gym, which I know you go to at least 4 or 5 days of the week, is to 3 days a week, thank you, at 6 o'clock in the morning, just up Edgewater Drive, is to take a foam roller and to just gently roll on those attachments of the sits bones in the gluteal area, in the buttocks. Okay, we're going to gently take Debo's leg back to its position here, and we're going to conclude with the sacral cradle. So you're going to place your feet back on the table. I'm going to place my hand underneath the sheet, and you're going to gently raise your pelvis and gently come down and come back up one more time and back down. Thank you. Debo is going to start her breath basically at the pubic bone, thinking that she is riding a wave in Maui or in the oceans of the Atlantic Ocean in Brazil, making a nice wave all the way to the crown of her head for the inhale. And the exhale will go down the back of her neck, all the way down each vertebrae until it reaches my hand at her sacrum. So let's take a nice 3 inhales through your nose and exhales through your mouth. Good. 2 more times. And last time. Good. Don't make any moves with your hips. And I want you to gently extend your feet. Before we say goodbye for this evening, some homework for Debo is to do the exercise we did 5 minutes ago, where if you're on a massage table and have access to a massage table, come to the edge
Access to a high bed.
or to a high bed and gently lower that right leg off the bed with the arm overhead with the curve to really lengthen out her chest, her rectus abdominis, and her groin muscle. And she's even going to do that on your other psoas muscle, psoas major muscle on your left side. That's the first part of your homework. The second part is we felt tightness on your sits bones where the hamstring attachments were coming into the right in the buttocks, And your second part of your homework is to take a foam roller and you're going to put it underneath your buttocks and slowly find that spot of tightness. And when you find that spot of tightness, I want you to hold it there, take some nice breaths, and then slowly make some movements around that tightness, and then move on to either further up into your upper hip or your hamstring. And that's going to help you from both a direct manner in terms of your psoas major and the balancing muscle, which are your gluteus maximus muscles. So I want to thank Debo again for her patience and her willingness to come after work for Rolf Session 5. To our videographer, Chase, thank you for your time in coming after work, and we'll see you in a couple of weeks. We wish you a good evening.